Hey everybody, welcome back to Urology 101. I'm James Farrell. Urology 101 is my video blog and it's on common topics in urology. They're often taboo and embarrassing just because we talk about sex organs a lot. Now, my goal is to get you some content that you can apply and you find useful. So in that aim, if you like this video, then definitely check out my website, which is urology101.com. The first part of that's spelled Y-O-U-R, and all the videos are there as well as some other content. Now, I also post everything on YouTube, so maybe you're watching it there. So if so, please check out my website. Also for everybody, Urology 101 is my Instagram handle, and I post most days there as well. Shorter format, great content, stuff that doesn't quite fit into a video, so definitely check that out. Now with that, let's get on to today's topic, and we're going to talk about testosterone, specifically guys who are low on testosterone, whether it's worthwhile replacing it, and is it actually that panacea for all things to cure male ailments that some people would have you believe. In some ways, there's some truth to that. In other ways, it's not at all. But it is a worthwhile conversation. I think it's a little clouded right now with all those male health clinics and vitality and whatever in the world that actually means. So let's get on to exactly what it is, what symptoms can go along with low testosterone, and then what you can expect from treatment if you decide to go that way, and obviously things you can do for yourself to make yourself feel better. Now, what is testosterone? Well, in short, it's a hormone. And it's a hormone that mostly is ascribed to men. Women do have testosterone, guys do have estrogen, but for the most part, it's in guys. And when you're developing as a fetus and an embryo, it's really responsible for making all of that. Right? It's the signal that tells cells to go that direction, to make a penis, to make testicles, to make the tube that takes sperm from the testicles to the urethra, to make the male urethra, and to make everybody's favorite organ, the prostate. Now, other things that it does, it tends to be responsible for behaviors that we ascribe to men. That's right, not asking directions, um, ego, definitely that's going to be one of them, and a lot of other funny things we can make jokes about. But it also is responsible for a lot of male pattern hair growth. It is responsible for men for bone density, as well as muscle mass and strength, and typical male fat distribution as well. From a standpoint emotionally, it's really responsible for sexual drive, sexual interest, which we usually call libido, and irritability, fatigue, lack of focus. Those things can be ascribed to low testosterone, so they might have some impact. And then sometimes erections too, not always. So in young guys, low testosterone, or let me just say that again, testosterone in general may be important for good erections. But we do tend to find that as guys get into their 40s, 50s, and 60s, that testosterone has less of an effect on whether erections really are what are as good as guys are looking for, and is a little more related to just overall health. So what is low testosterone? What does that mean? Well, it really means that you have symptoms that go along with low testosterone, which we tend to say when you talk about emotionally, we talk about sex drive and libido. Psychologically, we would talk about energy, lack of focus, things like that. And physically, have you gained some weight? Those types of things. If you have that group of symptoms, and it's been something that's developed over the last year or two, then there's certainly a concern for low testosterone. Erections at some level get into that again, but it's not 100% there. Now, in general, what we do is try and get a lab draw to see if, yes, the labs correlate with your feelings and how you present with some of the symptoms you talk about. And it's sometimes hard to decide, well, is this related to low testosterone or not? Because those symptoms, obviously the ones of being tired, gaining some weight, having less desire for sex, those things can develop in life in your 30s, 40s, and 50s as so many other things crop up in your life, right? As your kids have a lot of stuff that needs to happen. There are a number of things regarding job, regarding travel, regarding finances, and so much of your energy can get pulled in multiple directions. It's hard to tell if the concerns are really related to a hormonal change, or if it's related to just life. And then the next question would be a little bit chicken and the egg. Does all of these things in life that pull you in so many directions have an impact on causing you to have low testosterone? Or did low testosterone have something to do with you losing a lot of energy, focus, and having some weight gain? So it's a little hard to figure it out, but definitely if you kind of look at yourself and say, I don't feel like I'm me, I don't feel like this is normal, I feel a complete change over the last year, then it's really reasonable to go talk to your doctor, have them draw some labs, and see where your testosterone is. In general, testosterone for guys tends to peak in their 20s and starts to drop after that, slowly over time. Normal values are pretty broad, anywhere from like 350 up to 1,000, and don't worry about the units, but it's a wide range, and sometimes it's hard for us to identify what's normal for you, and so a trend is good over time. Unfortunately, we don't have people get testosterone draws when they're in their 20s unless they have symptoms of something. So we don't always know where guys start, so sometimes it's a little bit of trial and error, so bear with us a bit on it because it's not always certain that starting you on testosterone will solve all the problems. So we've talked a little bit about some of the symptoms you can have for low testosterone. Seeing a doctor is a great first step to get that lab draw, to talk to them about stuff. And there can be reasons why you have low testosterone. There are medical ones. Some of them are other hormones related. Some of them are related to the thyroid. There can be stuff that goes on with what's called the pituitary gland. But in general, most of the time when people have a low testosterone, we actually will not come up with a great reason as to why. We all have our own anecdotal and experience-based reasons, but we usually don't have a medical reason as to why you have low testosterone. What we do know is that we can give you testosterone back, and we can talk about ways to help you help that along. So let's get into that part of the conversation. When we talk about things that you can do at home, it's lots of the simple stuff to try and improve things. It's stuff like trying to make sure that you can sleep 7 or 8 hours a night so that you're fully rested for the next day. It's trying to make sure that you eat healthy, balanced diets, and that means the fruit and vegetable thing, and trying to get good sources of protein, and trying to get good sources of those fruits and vegetables, organic, stuff like that. It's also related to making sure that you're really happy in your relationships, and that goes along with making sure that you set time aside for yourself to think about whatever you want to think about, that you set time aside for your spouse and your family, and that you have relationships that you feel have good growth and love in them, because I do think that that's such an important part of just a total, kind of life moving forward that just is growing well. And so I think that relationships are an underrepresented portion of this, and that the behavioral health side of this really has a big impact, obviously, in how you're going to feel and what hormones are going to be so present in your mind day to day, because they do have an effect on how we think, feel, and our energy levels. Also, if there are things that you can find to be, maybe like happily competitive about and creative, those types of things to just pique your interest in stuff day to day, I think that's really important for this type of stuff. Now, in terms of what we can do medically, we can talk about replacing with either gels or injections to give you testosterone. Unfortunately, we don't have great ways to just give you it as a pill. There are pills that can sort of trick your body into making more testosterone. And sometimes we use those for young guys in fertility. Sometimes women get that in fertility too. It's called Clomid. But for the most part, once we are talking about low testosterone, replacing it for you is with a gel that you rub onto your skin daily, or with an injection that happens once a week or once every 2 weeks. Good and bad about both. With gels, the risk is transferring it to people who shouldn't have it. That means your kids, coworkers, spouse, that type of stuff. There are great ways to keep you from doing that, and there are great websites to talk about this too with frequently asked questions. The main gels tend to be Androgel, Fortesta, and Axiron. They all have their own similarities. They all have some slight differences in where you apply it and how much. But usually it's sort of a pump action type bottle that provides you a similar amount of gel and then a similar amount of testosterone in each pump. It's multiple pumps that we have you rub on your body after you shower, allow that to dry, then you can put clothes on, go about your day without any concerns. And several hours later, if there's going to be skin contact there, you can wash off the gel. By a certain point, there's really not much left. But websites are great to have little cartoons and frequently asked questions to help you get through that. The great thing about a gel, I think, is it's a daily concentration, that you get something every single day. And it's a little bit of buy-in from the patients. It takes some work and effort. So I think you're going to care about the medication, and I think you're going to try and take those steps forward to get back to where you want to be, which is why you sought help in the first place. With injections, great thing, it's pretty easy. You just take the injection in the shoulder or the muscle in your butt and actually just get it sort of as it just dilutes into your body over the course of several days. And that's great up front. You're going to feel good for the first 2 or 3 days. And then after that, the problem with gels is that you tend to have a little bit of a withdrawal where you just lose some of the medication daily. So that by the time you come back to needing it, you probably feel pretty tired. That's at least what I've found anecdotally with my patients. Now, again, that's not necessarily a problem, it's just a choice. You don't worry about the transfer, but you get stuck with a needle every couple of weeks, and you probably have some withdrawal from time to time. What we tend to do over the course of the first couple months is get some different lab draws, because giving you back testosterone can cause theoretically some risks. It can theoretically increase what are called triglycerides or some cholesterol levels, so we check those. Your liver has to metabolize it. We need to make sure that's doing okay. Your red blood cell count can actually go up, which can make your blood a little thicker, so we pay attention to that. We used to be concerned that giving you testosterone back would actually increase your risk for prostate cancer, of all things, but that isn't really the case anymore. We have a lot of research that shows that getting you back to normal levels of testosterone is not a concern for increasing prostate cancer risk. In fact, many of us who treat prostate cancer will also actually give patients testosterone if they are low on testosterone and it seems like appropriate. So we're not as concerned about the prostate cancer or testosterone risk anymore. If you have more questions on it, definitely talk to your urologist. One other thing that we tend to think about is sleep apnea. That's an important thing to look at too, because if you're not sleeping well, that really will reduce your ability to feel like you're getting a lot of energy the next day. And there used to be concerns about giving people testosterone who are undiagnosed for sleep apnea. So a lot of us will still ask you to see somebody in sleep medicine to see if there's a way to really help you there, get you on either CPAP or talk about better sleep hygiene to help as well, because we do know that not sleeping well over the long term will also harm your testosterone, and you'll never feel like you have good energy or focus the next day because of poor sleep. Hopefully what you get out of testosterone is a little more energy, a little more focus, a little more interest in sex, and also the ability to just sort of get out and exercise more, which will help reinforce all of those good habits that you want to get back, which is why you started talking to people in the first place. And if that happens, then what we tend to look for is getting you off of testosterone after some time. We don't have data on people being on this for 30 and 40 years, so it may not be a big problem, but it might be. And I think most of us out there who start guys on testosterone want to help them form habits that are good for them, so that when they come off it at some point, that they really have those habits in place and can just continue on with their life. One other concern about testosterone that we tend to think about is that it does increase your risk for blood clots in the legs. That's called a deep vein thrombosis. It's not a huge risk, but it's there, and there's no real way to modify that other than to make sure that you're not smoking. I talked a little bit about how to help reinforce these good habits on your own, and you can absolutely go it on your own. You do not need to take testosterone. I'm not trying to push a drug on you. I'm just trying to give you good information on what we talk about with our patients and things that we think matters for you all for better health day to day. I think that's a good starting place. If you have questions, get in touch with me either through my website or on Instagram, actually. I follow most comments there very closely. And I hope this has been helpful. So you guys have a good night. Take care of yourselves and your families, and we'll see you soon.